For the first time in nearly 3 years, the freshly renovated Bari Teaching Hospital in northern Khartoum is busy once again. On its first day back on Sunday, it received a patient from the Kordofan region, the conflict's current major battleground, for urgent surgery, an operation that doctors said went well. In April of 2023, the hospital was stormed by the paramilitary rapid support forces after fighting broke out between the group and the army. The facility was heavily destroyed and equipment looted.
Bari Hospital, like other government buildings and facilities, suffered damages amounting to 70%. The hospital is considered a referral center, providing services to all states of Sudan, not only in Khartoum. There's a huge difference in the hospital's condition before and after the war. All parts were damaged and all equipment stolen, but thank God, the surgical, obstetrics, gynecology and emergency departments have been restored.
Once the scale of the violence became apparent in April 2023, inpatients were rushed along dangerous transfer routes to other hospitals across the Nile region. Several medics didn't evade the RSF and were only released after a long detention. For many who did get out safely, they thought they'd never return.
We never imagined this hospital would reopen. If you saw it before it was restored, it was completely destroyed.
The hospital remained part of a war zone until the army launched a counter-offensive, recapturing Khartoum last March. And that's when renovations were able to begin. Reconstruction and the purchase of new equipment were funded by the Sudanese American Physicians Association and Islamic Relief USA at a cost of more than $2 million.
The most significant damage to the hospital was to its electrical system. All the transformers and cables were destroyed. Thankfully, we received 2 new transformers, which is a major improvement.
According to the World Health Organization, the conflict has forced the shutdown of more than 2/3 of Sudan's health facilities and caused a world record number of deaths from attacks on health infrastructure. As doctors, nurses and administrators hustle through the hospital's halls, many worry over salaries and running costs.
Before the war, we knew the amount of money being injected or spent. But now, after many years of war, the financial crisis has worsened. Salaries and incentives have been affected, and now the budget does not cover the expenses.
Before the conflict, the hospital treated around 800 patients a day in its emergency department. And while the numbers streaming in are nowhere close to that, for many, its reopening is acting as a beacon of hope, transforming Khartoum's outlook from despair into one of resilience and expectation. Caroline B., CGTN.